Okay, first measurement, supra. So hand on your head for me. I'm gonna take my thumb, I'm gonna follow the line of his hip to the top. I'm gonna put my caliper above my thumb. So my thumb is touching the top of his hip bone here. I can probably dig it in above his hip bone, but it's gonna be uncomfortable. So for consistency, just keep your thumb at the top of his hip bone. Put the caliper in a 45-degree measurement along, just above where your thumb is. And from here, you're gonna stretch out your hands along the 45-degree angle of the caliper, grab your skin fold, allow it to return back to the body, keeping the caliper to your elbow in a straight line, and then you're gonna take the measurement. So for the cheek measurement, I wanna keep my line straight, so it's gonna be a bit awkward unless I'm way taller than them to come up like this. So he can either take a knee or take a seat. Easiest in this situation is ask your client to go down to one knee for you, or grab a seat if they have a seat behind you. And then from there, what I'm looking at for this measurement in particular is I'm gonna look at the line of his eye and then the line of his nose, and we're gonna be coming here, right? This is a suborbital measurement more than the actual cheek. So if you draw an invisible line down from his eye and you draw an invisible line from his nose, this is gonna be just below the cheekbone for most people, as opposed to originally the traditional measurement was a lot more lower for this one. So from here, I'm gonna be drawing that again here, drawing that again, coming at like a 45-degree angle to his body, like so, taking the skin fold measurement, and then measuring like so. Don't be super pedantic. If he's got some sort of landmark, or you just think, okay, I can see his cheekbone, I'm just gonna go below his cheekbone, that's okay as well. Okay, so the next measurement is we're gonna be showing the way we do our pec measurement, which is gonna be a little bit different for male and for female. So for the male pec measurement, I'm gonna be getting in and measuring this underneath here. So I need this area to be open and free. Traditionally, bringing the arm behind the back can make it a little bit more difficult, especially if he's rolling his shoulder forward. So if your client's got good shoulder extension, just bringing your shoulder away, as long as they don't rotate, is gonna be the best way to get into this measurement. So if I just put him sideways on, just for viewing on the camera, what I'm gonna be doing, just putting him into a bit of shoulder extension for now. And I'm gonna take my finger and I'm trying to find the underside of his pec muscle, right? This is easy because he's got very clearly marked pecs. Not everyone's gonna have this. So what I'm gonna be doing is I'm gonna put my finger in the top of his pec muscle, and then I'm gonna be taking this measurement here. Yeah. And from there, I can measure that measurement nice and low. So this is, again, the way that we measure the pec at ATP, which is slightly different from traditional skin fold measurements. So once more, put your client to shoulder extension, make sure they don't rotate. You may need to squat down first to take the measurement, which is going to be here. Then you can come up and measure it properly in a straight line. Done. Okay. Okay, so for the bicep measurement, I'm going to start by measuring it out with having my client take a bent arm position. Again, try and keep it straight. Anything around here is going to throw off your measurements. And what we're looking for is the midline of the bicep. Now, if your client is lucky enough to have landmarks, like for example, he's got, I don't know if that's a blood vessel or a freckle for now, but anyway, there's a clear visual landmark on his bicep. That might give you a better consistency for measuring, but for the actual way of doing it, basically I'm gonna bend his arm and I'm gonna take my finger, pop it in here, I can take my other finger on the top of his shoulder, yeah? And I'm looking for the midpoint of where my fingers intersect, which, funny enough, is just below this person, but just below Brian's blood vessel or landmark here. So anyway, alternatively, you can just take the biggest point in the bicep. As I've said in previous videos, the The most important thing is to measure the same spot each time more than it being super anatomically correct. So I'm just gonna look at the bicep and go, okay, this is about halfway through the bicep. This is the largest possible position. This is a flat measurement. I'm gonna stretch out my fingers, take that measurement, extend your arm, and then ask him to extend his arm down to the ground. Good. Now there's no muscle in here, it's just fat tissue. Done. You can expect these to be very lean for clients who are lean. These are going to be the first kind of measurements, especially for men that lean out the first. All right, tricep. Perfect. So for the tricep, again, this measurement is usually going to be the top of the horseshoe in the middle. Again, not everyone's going to have clearly defined arms, so the leaner they are, the easier it is to measure. A lot of people have tattoos these days, so you can look for a landmark on the tattoo. Like this spot is going to be maybe ideal for this person, but for now, let's say I'm going to bend his arm, take my little finger on the bottom, take my little finger on the top, and then where they meet. So again, luckily enough, that actually reminds me of that circle there. For another one of the coaches here, they've got like some sort of wolf that I usually measure, or some eye or ear. But for now, there's your measurement. Make sure your arm is horizontal. Stretch. Extend your arm. And measure. Good. Realistically, to do it one more time, I would ask him, as soon as I take that measurement, to extend that arm out for me. Just to make sure I didn't take any muscle in that measurement. And then measure properly, okay? Subscapular measurement, he's got a landmark, so I can easily just use that landmark for consistency. But if I was going to be looking for it, if he didn't have one, I'm gonna bring his arm behind his back, and then I'm looking for the corner angle, the inferior angle of his scapula. So the reason why we ask him to do that is because it flares the scapula out, so I can then put my hand in that position. So if I just come around here, you can see that my hand is going to fit in, and I can find the point of that scapula by there. And where that gap of my hand is, that's where the caliper is going to go. So here, and then I'm going to put the caliper in there. So I'm just going to turn him slightly to the side so you can see me doing it without blocking the camera. I'm going to put that in there, and then where that gap in my hand is, I'm going to take that measurement, okay? So I make you put it back this way, and then from here, it's going to be a 45-degree caliper measurement along this way. So let's just, we can see the gap there. So I'm just going to put the caliper back, going to stretch out my hand over his shoulder blade, like this. Take that measurement. Don't yank on your client's back fat, that can be irritating. And then measure as so, keeping everything in a straight angle. Okay, hand on your head for me. So we're going to go through mid-axillary now, mid-ax. So I'm just going to have my client face the wall for me. Now, this is going to be on his sideline, but you've got to avoid taking the lat in this measurement because it's going to be much different. And depending on the size of the person's lats, this may adjust your measurement. So you're trying to measure the rib cage in front of the lats, okay? So if you want to just take the base of his armpit as opposed to being the junction of his arm, if you just take the base of his armpit and you take your little finger on the hip bone, where your fingers intersect, which is going to be roughly here on this gentleman, and I'm going to take a 45-degree caliper measurement here. Done. Okay, for the umbilical measurement, there's a little bit confusion over this one because Up here can be quite lean and quite visible, and then here is always going to be a lot of problem for people. I always like to go with the worst possible situation, but some people don't, right? So it's okay. I'm gonna redo that bit. Just keep going. Okay. Umbilical measurement. So there can be a significant difference measuring here to measuring here. A lot of people, especially men who are stressed out, struggle with fat around this kind of area. So it's important to get this right each time, because where you're measuring is going to be a huge difference. You measure here 1 week and then you measure here the next week, your man's dropped 2% body fat, right? And so for me, when I'm taking this measurement, I don't like to have to draw across the belly button because I feel like it just gets in the way and skags a little bit. So what I tend to do is I tend just to measure on the line underneath the belly button, just so this doesn't really get involved in that. So the way I measure it out is I'll put my caliper onto the client's stomach, just 1 point below where I'm supposed to be taking that skin fold. Any higher than that, like I said, is going to catch that belly button. So from here, I'm going to take the caliper here at the edge of one caliper. Now this caliper is quite large. Some calipers, like the Harpenter ones, are a bit smaller, but the ones we use, especially here in Singapore, are about this size. So I'm going to take at the end of this caliper to be consistent, just to make sure. This now goes to where my measurement is going to be. Stretch my fingers and then take that skin fold there. And as you can imagine, this is quite accurate in taking this spot, and it's a lot more I can feel. Even though he's relatively lean, it's still going to be twice as much as this measurement here. Quad measurement, you can either take this standing or seated. For clients that are overweight, a bit inflamed, it's easy to take this measurement, I find, seated, but we'll show you the standing version now. I'm going to take my little finger and I'm going to put it on his kneecap, and then I'm going to take my other finger and put it on his hip bone. Now remember just to have some discipline with your hands. You don't want to be stretching out like your fingers here. It's going to make your client feel weird. So really make sure with these measurements that you're keeping your fingers tucked in. Hip bone, knee, and then where they kind of see here, I'm automatically doing it to stretch my hands out. But where your thumbs come together, there's going to be a measurement spot. So I'm going to ask Brian here to just contract his quad. I'm going to take that stretch, making sure I'm parallel. I'm opening up for the video just so you can see what's going on, but I should be keeping a disciplined elbow angle the whole time. Stretching out, asking him to relax his quad, and then taking that measurement where it is there. Okay, so for the hamstring measurement, it's approximately 2 fingers down from the gluteal fold. So I ask my client just to pull, don't do it yourself, just ask the client to pull the shorts up for you a little bit on that side. Good. And I'm gonna run my caliper, not my hand, up the back of his leg until I get to the gluteal fold here. See, where the gluteal fold just means the fold between the glute and the hamstrings, okay? What I'm going to do then is I'm going to put my fingers in there to measure that, 2 fingers. That just gives me enough space so that I'm not actually grabbing the glutes when I take that measurement. I'm going to horizontal measurement with the calipers here. And then from here, this can require a bit of strength, especially if someone's inflamed. So from here, I'm going to stretch my hand, really squeeze. This is the only measurement where I use a 2-finger grip. Every other measurement I can take in a single one. So from here, 2-finger grip to make sure I've got a strong grip on that hamstring, and then I'm going to take that measurement. I've opened up for the camera, but I should stay disciplined and keep my elbow angle appropriate to make sure everything's in a straight line and consistent. So for the calf measurement, I'm going to ask my client to turn his foot out. this is going to give me better access to his legs. Now sometimes the calves can be really tight and inflamed, so if you're finding that it's just so hard and dense, you can do a couple of things. You can just deload the calf by asking him to go up on his toes on this foot. Yeah. Now he's put on weight, it's going to be a bit harder, but if he keeps up on his toes but transitions his weight to that leg, so just put your weight on that leg, but lift your foot up slightly. No, your heel, sorry. Yeah, good. It's going to make it a little bit more pliable and easy for me to measure because the calf's going to be contracted underneath, right? Alternatively, you can just sit them down. But for him being lean, it's not going to be an issue. So just make sure his leg is externally rotated and you're just looking for the largest part of the calf. So if you just run your hand down, you just go, okay, this is the bit that is the furthest away, and then it drops off, right? So this is where I'm going to be measuring. And to measure it, I put one thumb inside on his kind of shin bone, and then I stretch my hand round as far as I can to make that measurement. We'll do a close-up in a bit so you can see a little bit more, but for now I'm just going to ask him to open up a little bit more. I'm going to take my thumb, assuming this is the largest part of his calf, put my caliper measurement there, open out my hand, pull through, and take this measurement in a nice angle. Simple method for the obliques. If you can see them, measure them, but if you're eyeballing it, you're going to go from the line of the nipple all the way down and where that intersects with the belly button. So for him, it's going to be here. If I really stretch his skin out, you can see that that's actually on his oblique fibers. So again, I'm going to draw a line, imaginary line down from his nipple, and I'm going to cross that with the line of his belly button. And that's where my caliper measurement's going to be. Yeah, from here, stretch out my hand, take the measurement, and done. Okay, so scapular measurement when measuring a female client with a sports bra. When I'm taking my measurement, I'm going to set up, and I'm approximately always going to be underneath the strap. And even if it wasn't, measuring through a strap is going to be difficult. So I need to use this arm in order to be my measurement arm. So I can't ask the client to hold with this arm. So I'm going to ask the client to, if they can, bring their hand through, grab their strap, and pull down to the side to expose this area for me. Now, not everyone's going to have that shuttle mobility, so you're going to have to work it out some way. I think that you can help, you can guide, but most of the clients in my experience are able to make that grip themselves, especially female clients who've got a bit more shoulder mobility. And then from there, everything's going to be pretty much the same. Use this as a guiding measure. I'm going to take one knee just so you can see what I'm doing. I wouldn't normally take one knee. Make sure that my hand is in the right position. See where I've got to take that measurement, and now because of this, I can take a full stretch with my hand. I can ask the client to bring their hand back down to the side so I can measure, stretch, take that skin fold measurement, be careful not to yank on their back fat, and measure. Done. Okay, the last different measurement when measuring males and females is going to be the pec measurement. Now, because of the clothing and the way we set this up, for female clients, we're going to use a caliper measurement. And again, these ones are quite big compared to other calipers, but from the armpit down. And if you feel like this is too big and this is going to make it awkward for you and your client, you can just use a standard measurement like the size of your hand for like 2 fingers. So for me, I tend to just move my client's arm out the way. I don't tend to internally rotate it too much because it kind of bunches up the measurement. So I just use a bit of shoulder extension. And then I take 2 fingers and I'm going to be measuring here. Now, this is going to be blocked by the client's clothing. So set up first with the clothing on, just so you can say, hey, listen, I need to measure by this spot. So I just need you to pull down your sports bra by about like 3 to 5 centimeters for me. Good. Just exposing where the measurement needs to be. And now, if the pec runs at this angle, you're going to be cutting it like an X shape along that angle, right? So the measurement isn't horizontal, the measurement isn't vertical. It's going to be, isn't horizontal, isn't going to be vertical. It's going to be vertical to the line of the pec. So if I go again, try not to get my client to twist, 2 fingers in here, and then vertical to the line of the pec, stretch my fingers out, take that measurement, ask my client to contract their pecs if they can. Good, make sure I clear out any muscle tissue in there, relax, and take that measurement. Quite often, you're going to have to learn to measure through tights, and this is because your client is going to come in wearing them. They may have forgot, that's all they have. You can remind, I'm just carry on, I'm just going to restart this one. They threw me off. So quite often you're going to have to measure through tights, and that's either because your client forgot the right attire or that they only really have tights or comfortable training in tights. So you can still do the measurements, you don't have to ignore them, you just need to know exactly how thick the measurement is. So all you're going to be adding is just pinching the material here and then taking a skin fold measurement of the material. Now, for most tights, and I've measured a lot of these, they're either 0.8 or about 1 mm, and it's going to be complicated to try and take that off. So I think either just round it to 0.5 mm or 1 mm, depending on which calipers you're using, and just remove that from the measurement. It's a consistency, right? So it's not going to be the difference between 2, 3, 4% body fat because you've been 23 or 24 on the quad measurement, right? So it's completely fine. So just measure that and then just follow the same way as you would normally measure. Little finger on the knee, little finger on the hip bone here. Keep your fingers tucked in to be polite, and then where your hands intersect. Now I'm going to be polite, disciplined with my hand to elbow ratio. I'm going to make sure that my fingers aren't flared out when I'm doing these measurements. I'm going to ask my client to measure their tense their quad. Squeeze this measurement. Now your fingers can slide if they're on tights, so you have to be a little bit more aggressive when you're taking through tights. Take the measurement and then remove your 1 mm from the measurement before you log it in, okay? Okay, so for the pec measurement, you want to just make sure they're up and open, right? When we do this new kind of measurement, I want to be getting in underneath here. So in this posture, I'm not going to be able to actually get into the measurement. So if I turn him sideways on, I need access to slightly below his pec. So what I'm going to do is I'm going to bring his hand just back and down. The more you bring it up, the more that shoulder rolls in and you actually hide where you're supposed to be measuring. So for me, all I ask them to do is just bring their hand back and clear that space for me, all right? So when I take this measurement, I'm kneeling down just to show you where it is a second. What I want to do is I want to get my finger under the line of his pec, yeah? Trying to put it on his center line, and then without this arm being there, just to show you, this is the line of his pec, right? And I'm going to be taking this measurement because this is what I want to measure. Traditionally, pec measurements were taken up here, but with our new formula, our pec measurement needs to be here, measuring this tissue. Actually, I'll start this one again. I'm facing away from the camera. I should be facing the camera. Let me just cut. George, you want me just to delete this one?